But thank you, Misha, so much for that introduction. And I want to join in the remembrance of our colleague and mentor and friend and badass warrior, Toni Lee. Rest in power, Toni. My name is Paola Maranan, and I use she, her, hers pronouns. I'm a Black and Filipino woman with dark skin, black hair, wearing a blue and white dress, and I'm against a white screen background. As a Seattleite, I acknowledge that I am on the traditional land of the first people of Seattle, the Duwamish people, past and present, and I honor with gratitude the land itself and the Duwamish tribe. Thank you to the Washington State Budget and Policy Center for the opportunity to be a part of today's Budget Matters gathering. As a longtime fan, partner, and donor, it's an honor to support your mission and work. I've seen firsthand the evolving work you've done to acknowledge the impact of racism, not only in the policy and budget work you do, but also in the way that you do it, whether that is in the analysis, the acknowledgement that what is important isn't always measured, the words chosen, who you gather together, or who you listen to. It is my privilege to be part of today's continuation of that work. As today's panelists and I gathered over the last few weeks to talk about today's discussion, we only half joked that our answer to the key question, where do we go from here to ensure an equitable recovery, might be best summed up with an image. And I don't know if you'll be able to see that since we had to switch over to the Zoom, but if you've ever seen the 1995 film Waiting to Exhale, you might know what I'm talking about. And I think it's coming up. There you go. That's the image we were thinking about as the panelists and I were talking about how to answer the question, where do we go from here to ensure an equitable recovery? If you've seen the movie, you recognize that is Angela Bassett taking all of her dysfunctional husband's things, piling them into his car, setting it on fire, and walking away. So over the next hour or so, you'll hear today's panel offer the spoken version of that image. To build an economy that works for everybody, we cannot accept a return to pre-pandemic normal. There is an adage that each system is perfectly designed to get the results it gets. What the pandemic laid bare is what folks in communities of color have known. First, the economic, health, safety net, and justice systems were never meant to work for us. Our panelists will share their expertise regarding how systems are working perfectly to get their inequitable results. Second, getting different outcomes will require deconstructing these perfectly inequitable systems and building anew. This is an opportunity for radical transformation, as one of our panelists pointed out. Nibbling around the edges or trying to throw a little equity onto inherently inequitable systems will not do. Finally, everyone has to have skin in this game. The burden cannot fall on the communities whose resilience and brilliance is already hard at work to survive within and despite the systems built. Our future as Washingtonians is shared. To transform and reconstruct, we need different policies and investments and a different way of getting to both. We cannot build anew, relying only on old ways of measuring, old ways of knowing, old ways of communicating, and old networks, expertise and power. What was clear to so many before should be clear to everyone now. Normal is a state of injustice and inequity. In the spirit of that picture of Angela Bassett, time to light the match. So let's turn to our panel to learn more. It's my honor to introduce a treasured friend and mentor, CEO of the Native Project in Spokane, Toni Lodge. Toni is an enrolled citizen of the Turtle Mountain Chippewa tribe of North Dakota, a longtime Indian community activist. Ms. Lodge helped establish and build the Native Project in 1989, an urban Indian health service clinic that provides health, prevention, and culture programs to members of over 300 tribes who live in Spokane and to people of all ethnicities. Toni currently represents Eastern Washington on Governor Inslee's Safe Start Advisory Group as Washington moves forward in reopening and recovering from the effects of COVID-19. She is a passionate and vocal advocate for equity issues and dismantling systemic racism, building capacity and access to care for people of color, developing culturally specific medical and behavioral health systems of care, preserving Native culture, and for leaving the planet a healthy place for our relatives, her children, and especially her 10 grandchildren. It's next my pleasure to introduce Pamela Duncan. Pam is CEO and president of the Metropolitan Development Council. She embraces that her purpose in life is that of a servant, helping others, leading by example, and finding ways to leave a trail of goodness in her wake. Born and raised in Cleveland, Ohio, Pam earned her BA in Organizational Communications at Ohio University and her master's in urban study from Cleveland State University. She served as a high school teacher and a mentor to young people with whom she has remained in touch for almost 30 years. Before coming to MDC, Pam worked with United Way of Pierce County in the city of Tacoma. She is also an ordained minister and an elder within her church. Pam is passionate about the promotion of equity and promoting a better understanding and appreciation for the dismantling of institutional and individual racism. Finally, we want to give a very warm shout out to our colleague, Abigail Scholar. Abby is the Executive Director of Central Washington Justice for Our Neighbors. Due to unforeseen circumstances this morning, she could not join us today, but we are so grateful for her work to develop today's panel and help us tell this story. Thank you, Abby, and we wish you the best. So please join me in welcoming to our virtual stage, Toni and Pam. We start our panel discussion with the assertion that the systems that have failed communities of color were never designed to work for us in the first place. So I'd like to ask each of our panelists to spend just a couple of minutes responding to the following question, and Toni will have you respond first. What is one story you would tell about the impact of the pandemic on your community? How does that story reflect our assertion that these systems were never designed to work for us? How is your story rooted in systemic inequity? And Toni, would you like to join? Would you like to start?
Everyone, what an adventure in Techie land. As Paula said, I'm a grandmother first, a Native woman second, and a community activist last. But I'm a business person, and I do run a medical facility that has licensed substance use and behavioral health services in it. Back in March, we were the first clinic in Spokane to test a positive COVID patient, actually on March 14th. Nobody knew what was happening. We had no instructions. Our FEMA and emergency preparedness was not in place yet. This young woman pulled up with her car full of kids. She was very sick and she knew she needed to get tested. In our clinic, we scrambled around. I mean, it was actually March 12th because her test came back on the 14th. Hope I can tell it. Our youngest doctor and our youngest medical assistant, two young women said, we'll do it. They got as much protective gear as we had available, went outside and tested her. And of course she was positive, and her children were, she was in this little apartment with her children. And I was upset in so many different ways. One, our federal supply system had sent us 10-year-old expired N95s, the federal system from the federal warehouse in Oklahoma. That's as good as we got at an Indian Health Services facility, was 10-year-old expired protective gear for the youngest, most vulnerable medical professionals. Secondly, nobody knew what to do with this woman locked in her apartment with these children, her tiny little apartment. And the next day, the Group Health Foundation called me and said, we will give you $100,000 today. Can you use it? And I started crying because they said, we understand the inequities. And they didn't know we'd had the first positive family. I went and bought food, cleaning supplies, and Barbie dolls, because that is what the mom said her kids wanted. But I thought about it. I thought, that was responsiveness to need in our community. None of my federal funds would have covered Barbie dolls and food, what we needed. it was a funding source that was responsive to our community. And the other part of that, a lot of times I feel like I am the, I feel like the more we comply with our grantors' requirements, the more colonized we become. And the more we perform to metrics and audits and reports, the further we get from our mission. And that's to serve that mom and her kids in that little apartment with a deadly, fearsome disease. And it's been variations of that ever since that day in my community in Eastern Washington, in the urban Native community. I didn't think I'd get that emotional about that.
Thank you, Toni. Thank you. Pam, can we turn to you? We're looking again, just telling a story of what you've seen in terms of the impact of the pandemic in your community and how you see that story rooted in systemic inequities. And Pam, we can't hear you.
How about now?
Yes.
Okay. Thank you. And Toni, thank you for sharing the experiences that you personally have had and that of your people. Thank you so much. I first just want to acknowledge my ancestors, and I have representation of my ancestors in the background, kente cloth and fabric that comes from Abidjan, Cote d'Ivoire. I mention that because as an African American woman, we have a history in this country that is steeped in oppression, depression, dysfunction that has resulted in systemic trauma. And so when I talk about what I have seen in my community, it is based on how our people have been treated since being brought to this country. The data is very clear. It's no surprise to anyone that we already have been functioning or trying to function in an environment that has at its roots intentional, systemic disparities built in. And so we see the results of that, and it should not be a surprise. So as it pertains to education, people of color are always disparately impacted and show disparate outcomes, and the achievement gap always is not in the favor of Black and Brown people. We know that with housing, it's the same thing. Many of you are familiar with the report that was issued several years ago, Supporting Partnerships for Anti-Racist Communities, that really highlighted the disparities and the intersectionality of racism and homelessness. Also, as it pertains to economic wealth, that there are disparities, that Black and Brown communities are less likely to have that economic wealth, which typically comes first and foremost by being homeowners. And then the issue of employment, i.e. unemployment, where Black and Brown communities are typically, again, disproportionately impacted in a negative way. I'm walking us up to this is what we walked into with the pandemic. Already layers upon layers upon layers upon layers of disparities and weight on people of color, and particularly in Black communities. So when we entered the pandemic, and people are already weighted down with all of these disparities, it's no surprise that what we are seeing in terms of the impacts of coronavirus are as they are, that people of color are also disproportionately impacted, that our systems are already set up to produce what we are seeing. It's not happenstance. And again, it's just one more thing on top of everything that we have already been experiencing. People of color tend to have the lower wage jobs. So they are, one, the first to lose their jobs, or they're working those frontline jobs where they are being exposed, unduly exposed to the virus. They're catching the bus more so. So there's another risk of exposure. And people are also losing their child care because child care centers are closing again due to the virus. So people are now tasked with, do I go to work? Do I leave my children at home? What do I do? I've just given you just a couple of examples of all of the ways, everything that's happening. As we talked before, Paula, it's just lather, rinse, repeat for our communities.
Mm-hmm. Thank you so much. It occurs to me to think about the fact that folks have talked about the pandemic as being an equalizer. We are all, subject to the possibility of getting a virus, becoming sick, et cetera. And because it has such widespread impact, that there's some sense that there is an equal impact. And what I think is so clear from what you both pointed out is that this is the compounding effect of systems that were already failing our communities, not being equipped to help our communities, when not being any more equipped to help our communities in this moment. Pam.
I failed to mention the health disparities, and I would be remiss if I didn't talk about the health disparities, and that people of color are disproportionately impacted by diabetes, obesity, high blood pressure, heart disease, and we know these are all underlying conditions that make people more susceptible to coronavirus. Now, it's not that people of color are just naturally obese or just naturally have high blood pressure or just naturally have heart disease or diabetes. It is the environment that we are subjected to, where there are food deserts, so people are more prone to have to go to fast food restaurants to eat, which causes high blood pressure, high cholesterol, and also are limited economically to have access to health care, or because of the history of healthcare in our country for people of color, there's an extreme distrust. All of these things, again, as you mentioned, Paula, are the compounding effects that we are now seeing made evident.
Yeah, when you look at the list of, and I know, Toni, you did this as well, when you looked at the list of risk factors for COVID, and I looked at it too, it's asthma, folks with pre-existing conditions like diabetes, asthma, et cetera. You look at those lists and you see that those are our communities more represented in those lists. I am one, I'm one of those folks. And so it is, it again is sort of a reminder that normal should not be our aspiration, because normal for so many of our folks and a growing part of the state's population is a normal of inequity and discrimination and systemic racism. I'm going to move us to the second question because I think we are kind of moving in that direction. So we've already talked a little bit about how the systems were not built to serve us and are not serving us, and that's bearing out in COVID. So my next question to you is really, and this comes really at an inspiration from something you said before, Pam. This is a moment for and an opportunity for radical transformation. So how can we follow the lead of communities of color? How are communities and leaders taking systemic deconstruction and building anew into their own hands? What can we learn from community about how to build up just and equitable systems? And either one of you who would like to go.
I'll go. I also want to say to what Pamela said is The list, the health disparity that's not ever listed on the list is unfunded health care for 500 years or 100 years. That is the biggest risk factor why people of color have disproportionate outcomes in COVID is neglect. But when we're talking about the constructs that I want to bring forward, one of my friends says 2020 means 2020 vision, and that everybody else gets to see what we've seen our whole life. And we've had this public health education that I've never had before, and I've worked in healthcare forever, about flattening the curve. I mean, about flattening the curve of the disease, but I also think it's an opportunity to flatten the curve on racism. It's an opportunity to flatten the curve on income inequities. It really, Pamela's right, this is radical transformation. Read the room. Thousands of people went to Standing Rock. Millions of people went to Black Lives Movement. It is time for change. There is no other option. I'm on a board that met last week, and they were tiptoeing around the issue of equity. And our president of our board said, well, can we just kind of ease it in? We don't really know what to do. What can we do? And I said, we have no other job right now than to figure it out. And I'm not going to do it because I've been doing it all my life. I have 300 pages at the FBI on me. And that's from the 70s. But anyway, we have to figure this out. There's no other place we can go. And in our communities, we have to shift the paradigm. Money does not come first in Native communities and other brown communities. Spirituality comes first, and people come second, and the planet, because we're part of the planet, and then our revenue, our income, our way to make money. But I want to let Pamela talk because I love listening to her, but I want to talk about the language that we speak to. I'm tired of hearing about the culture of poverty. I'm tired of hearing about marginalized, disenfranchised. That reinforces systemic racism. I want to talk about the culture of capitalism, or the religion of capitalism, and how much damage that has done to us in our communities. So I'll let Pam talk.
Thank you, Toni. I for one want to read the file. So when you publish it as a book, let me know.
My daughter got it.
Pam, please.
Toni started talking about the religion of capitalism, and I was just ready to lean in, like, come on, talk about it. I think when we talk about, what has to be dismantled, okay, it's everything. It's the implementation of that visual of Angela Bassett doing what she did in that visual that you provided, Paula. Now, in a pragmatic sense, that first comes across as that's not practical, right? How do you just blow up everything and then what do you do? But what is evident is that every single system in our society is intentionally built upon racism. And racism is a social construct based upon the fallacy or specious lie that there are some people who are inherently better than others. Hard stop. And if we are going to change what we see and change the outcomes, we cannot continue operating the way we have been operating with the systems that we have had in place that we've all grown up in, because otherwise it's the perfect definition of insanity. We're still going to get the same outcome. So it means listening. It means that the people who have been historically those who have benefited from the systems must be willing to, one, listen, two, learn. And the way that we learn isn't always based or solely based on quantitative data. There's the qualitative aspect. There is, if we just think about the systems that we have, let's just talk about healthcare and how healthcare has been institutionalized in this country. It was based upon people who had the privilege to work. Healthcare was being provided by our employers to people who are employed. And that's nice and that's good, but that doesn't mean that healthcare insurance should not be provided equally across our community, because as the least of us go, so goes the rest of the community. And so we have to listen to the stories, just as Toni was expressing, about what happens in our communities as a result of the disparities. And the last thing I'll say, and then turn it over to Toni, is that for white people, when the conversations about racism and the learning about it starts pushing up against your stuff, you got to be ready to lean into that discomfort, because we've been uncomfortable for a very, very, very long time. And there is enough in this country and on this planet for all of us.
Mm-hmm. Yeah. Toni, what would you like to add?
My hands up to that for sure.
Mm-hmm.
And that is the biggest redistribution of wealth and inequity is to change that religion of capitalism to the one that there is enough for everybody. I just want to say about how much energy it takes in communities of color, in businesses of color. We have a business, not I have a business, that started with $100 and grew it to a $16 million business. I have young professionals that come in, start working for me, or students, and they're like, oh, have you heard of this business model? This is what you should do. I said, no, you need to study me. You need to study women of color that you never learned not one day in your undergrad or graduate schools. We don't know, you don't know what we know, and how we, and not just survive, but thrive in our communities. And I know so many women like me, so many business people of color like us that know how we get this done. But one of the things I want to talk about briefly is about how you fix the inequities. I think, like I told our board last week, is you use participatory budgeting, not just when figuring out the tax structure, which was a mystery to us. I never got taught that on the Turtle Mountain Indian Reservation about the tax structure, because we had no tax structure on our reservation. And the other thing in the Constitution, look it up, the only Indians that are natives that are counted in the census are taxed Indians. Mm-hmm. And the supreme joke of that, no Indians were taxed because of the genocide. There's no tax code put on reservations because the US Congress was pretty sure we'd be gone by 1850, a planned campaign of genocide. So we didn't know about it. I don't know about it. Had to learn everything on the ground about how to get money. But back to participatory budgeting, figuring out a tax structure, teach us all, not just in allocations, not just cuts. The analogy all the time is you got a seat at the table, you get invited to the table, blah, blah, blah. But my thing about that is the table came from resources that we provided from this land. The table was built by people, Black and brown people, with no or cheap or no labor. We made the table. We need to be in this together. It's not just a seat at the table. It's bigger than that. We all have to be in this together. And I did like what the representative said about this is no time for half measures. I run a drug treatment program. That's our mantra. You're either in or you're out. You wear your seatbelt or you don't. You use family planning or you don't. We have to use this equity lens. We have to get so practiced using it It is like putting your seatbelt on when you get in your car. Every time you think, every decision you make, we have to retrain ourselves to dismantle racism and use that equity lens. I got more to say, but I want to hear Pamela and Paola.
Well, I think I'm going to move on to the next question in a moment, but I think one of the things that's really important, particularly as folks who are on this, who are participating today, are all policy and budget folks, is to recognize that, again, systems are designed perfectly to get the results they get. These are policy systems, programs, all of this was designed perfectly to get the results they get. And it is about connecting the dots of history. So when you talk, you know, Pam, you were talking about the people who had the luxury of working. I think the other thing, obviously, you know, we talked about this previously, is who got the recognition for work. So there was intentionality around the folks who got left out, whether that is domestic workers, you know, people who worked in other folks' homes, agricultural workers, all of those folks who were Black and brown folks primarily were left out of these systems. And that has compounded to this day. And so that's what you see in terms of the histories of our body and the histories of the policies that bring us to a place of making us more susceptible to the impacts of this pandemic, both economically and health-wise. And I would say also that you don't even have to go back decades. I know that one of the things that Toni has brought up many times is you know, what we set up, how we set the table today is certainly impacted by how we have set the table up decades before, but we're also not doing as much work as we need to do to change the table today. One of the things, Toni, I've heard from you many times is the lack of culturally specific care east of the mountains. And I think one of the things you said was, if you're an African-American woman looking for mental health treatment, you know, culturally specific, culturally competent mental health treatment on the east side of the state, good luck to you. I don't know if there's anything that you would add, but I think it's as policy folks, we have to connect the dots of history to the way that our systems are designed, to the compounded impacts they have today on inequities for people of color. Go ahead, Toni.
I was going to say, Department of Health predicts a tsunami of suicides and other diseases of despair in Washington State during November and December. But like Paula said, if you can't close your eyes and think of the premier African-American drug treatment center in the state of Washington, that's a disparity, because you can't think of that place. Or the premier Native American woman behavioral health center. Those places don't exist. And so our despair is going to be so much higher once again as we come out of this. And we're not funded to do that. We have the money, county commissioners, the money is not directed to communities of color in behavioral health.
Yeah.
And that's the truth.
Yeah. So we're going to switch over to questions from our colleagues across Washington in a few moments. But before I do that, I want to ask a third question. Given that we are policy and budget nerds, proudly, we'll all put on our advocacy sash and put on that policy nerd badge. What's missing? So moving from the policies in themselves to the process of building policy and budget, what's missing? How do we remake the system of creating policy? You know, if this is a moment for radical transformation, how are we remaking that system of creating policy? What expertise is missing? How does our advocacy have to change? Who might have to give up power in order to do it?
I'm happy to start that discussion. So we're here because of budgeting. And we heard earlier in this venue that a budget is a moral document. What occurs to me as we talk about dismantling and reconstructing is that the budgeting process, an important piece that must be incorporated is, so sometimes we say a lens, I don't know the term I want to use here, but a racial and cultural equity and cultural equity and justice approach and the reason I kind of hesitate about saying lens is because you can always take your glasses off, then you can't see. But this has to be integrated into the budgeting process, and that that consideration can't be just merely 5% or 10% of the overall decision making. It has to be really considered a priority, because we know, for everyone who appreciates the data, we know the data is already there. The data shows us the disproportionalities. And then for that all to happen, again, we have to have the voices of those with the lived experiences, or those who are elected by those with the lived experiences, the Tonis, the Paolas, the Pams in our community, to speak on behalf and to say, this is what equity looks like in this regard. And lastly, it must be participatory budgeting. Mm-hmm. So that's what I put out for consideration.
Wonderful. Toni, what would you like to add?
Again, if we don't teach participatory budgeting and practice it like the religion of capitalism as we move forward, none of this is going to do any good. I just want to let our allies here know that you have no idea how much energy it takes in businesses like mine and communities like ours to bend that arc of resources and money and energy to our community, because really there's no path that runs through the urban Indian community of Spokane, Washington, that delivers resources and the truck stops out in front and throws it off. Except in COVID, it's kind of been that way. We've gotten some upgraded PPE, and just how much energy in our community it takes to undo the racism and build systems at the same time. So we're doing three things at once. We are super women. And I just want to say the last thing about land acknowledgement. It was beautiful that you offered today, but I just want to say, that started in South Africa. That was Nelson Mandela who came up with that when he did his Truth and Reconciliation tribunals in South Africa. And he made those colonizers acknowledge whose land it was in South Africa, who took the diamonds and the other resources out of there. And it went to Canada. And Canada is now in a process of truth and reconciliation with the Indigenous people there. We've not done that in the United States. That has to be done. We can't say the land acknowledgement and not acknowledge the crimes that happened here for Black and brown and other people. I belong to a professional Native women's organization, and about midnight we laugh. And this is my joke for the budget people today. Our land acknowledgement is we want our land back, and that's, and there's something to that. There's something to that. And the last thing is, you talk about, I saw how many Duwamish tribal, you're on Duwamish land. Duwamish have never gotten their recognition or their land. Why? It's in Seattle, Washington, the highest real estate in the country. And it was the same for the Puyallups in Tacoma in that port. So we get acknowledged, we get recovery, we get rebalanced only at the whim of capitalism and how much money this costs or doesn't cost the dominant society. And so that's the part that needs to change in truth and reconciliation via participatory budgeting. One way.
Pam, you are looking thoughtful. Is there anything that you want to add in this moment?
Really, it was, it was a heartfelt reaction that I was internally when you said we want our land back. And I can relate to that. I can relate because people of African descent in this country who were brought to this country want reparations. And and an apology. So that's another conversation. However, it does have implications for the discussion that we are having here. And because Paula, I know you're looking at the questions, and I was thinking about my responses to some of the questions that were posted.
Mm-hmm. Yeah, so I'm going to move on to the questions from our colleagues, but in the transition to the question to our colleagues, I want to turn the lens, and actually, you know, when you were talking, Pam, about the lens, I had not thought about that before. You can take lenses off. So I hear you saying that we need to get some anti-racist LASIK surgery. Can't take that off. Let's get us a racial equity LASIK. But I think before we turn to our colleagues with their questions, let's turn the lens to ourselves as advocates, because we've talked a little bit about what systems need to do to change. And you both touched on this a little bit, but can we dig in a little bit further? You are both folks who have quote unquote made it to the table. You know, all three of us are folks who have made it to the table. Somebody found us and invited us to these various tables, and we get to be part of some policy discussions. But the three of us are also folks who have been to Olympia and looked around and been in our local city and, you know, county and municipal government buildings and looked around and not seen a lot of folks who look like us. So what would you want to say to our colleagues who are mostly white in this field, and frankly to ourselves, because I'll own that I hold up these systems in my roles as well. What needs to change about our advocacy? What do we need to be doing differently so that we have our anti-racist LASIK surgery?
Mm-hmm. I'm reflecting on myself. I grew up socialized to be concerned about what the dominant culture would think about me and to make certain that I didn't cause any waves. I grew up in the up South in Cleveland, Ohio. That's just the South up north, very segregated. And segregation causes a lot of things. It causes fear, it causes distrust. It doesn't allow for the opportunity for people to come together and hear one another's stories and to lean in together about how we become better. And so for me, when you ask that question, I think about it is past time for me to speak my truth, to speak about this is the impact of how these systems are created. This is the real story. I'm not going to say what I think you want me to say, what I think you want to hear, but this is the reality of it. And I believe that we can link arms and walk together towards really, truly, for all of us who are willing to see something better, that we can do that together.
Mm-hmm.
Just say that it is like drug treatment, this whole detoxifying, learning new steps, maybe not 12, but we need to learn a few more steps. One of the things I hear all the time in the meetings I'm at in Olympia, other places is, you know, we're better than that. We're better than this.
Mm-hmm.
I'm like, no, you're not. No, we're not. This is reality. And quit being in denial, using the drug treatment analogy again. We're not better than this. Like we said in the beginning, this is how our system is designed. This is who we are. We practice racism. I practice colonization. Like I said, when I jump through all my hoops to get federal money, and I really hate myself some days for doing it. At the end of the day, I'm like, I really just kind of sold my soul to serve my community. Okay, I'm going to mitigate that in my own soul and head. But this is who we are.
Mm-hmm.
And so all us as allies have to say, okay, we're, I live in Eastern Washington. They want to start the 51st state, white nationalist state of liberty. That is who we are. We elected that guy to go to Olympia and represent us. This is who we are in Washington. And we call it, my friend Winona LeDuc calls it, we live in the deep north. We assign racism to the South. We live in the deep north. It's as racist here as it is in the South. It's everywhere. Look at the vote. Look at the vote.
Yeah.
So anyway.
I think that's what's so important about what you've both raised about lens or LASIK or however we want to describe it, which is, I think there are times when we get really sort of righteous about the racism that happens by people who have particular regional accents and in other parts of the country. But if you look at our outcomes in one of the richest areas of the country, our outcomes don't indicate that we are as better off as we could and should be. And certainly that results in systemic racism. I'm going to move over to the questions from some of the folks. And I'm going to start actually not talking about, I'm going to start by centering our communities and ask this question: how do communities of color work together collectively, minus reproducing dominant culture practices of racism against each other? So how are we working collectively and not reproducing what we ourselves have experienced?
I'll just really briefly say, we're taught horizontal oppression. Again, our system is set up to keep us separate. Our coalitions are not smooth, intertribal, reservation versus urban. But we are doing, that is our work of decolonizing, is to reach across and say, Black and brown, BIPOC people, if you look at our histories, we've had the same oppressions, and we've got through it together. And it's as hard for us to do that as it is for the dominant society to do their stuff. Taught to us all our lives to not trust others, have that same kind of division. And it's kind of exciting. It reminds me of the 70s again. That's second reference to the 70s for me. It was good times. Good times.
Great close. I'm going to move to the next question, and then our answers can be really fluid. So we're going to come out, as we are coming out of this, and you are both very involved in work about thinking not just about the now, but about what's going to what happens as we try to recover, not replicate, but recover. What are some, so as you think about prioritizing, what are policy and budget choices that should be high on the list because they will move equitable outcomes for our communities? And then similarly, I'm going to add this other part, which is, what are the kinds of things that we need to do to, so budget and policy choices, system changes that produce equitable and fair results and tackle racism. So what's on your to-do list, and what should be high on our to-do list?
I'll just give my short list.
Housing.
Oh, housing. I would say healthcare, universal healthcare. We will get better jobs and better educations when we feel better and we are not starved. We have no dental. Indian Health Services funds this much dental. People don't go to work for dental. It's the number one reason people go to the ER before COVID. Have a healthy workforce and healthy families, including behavioral health.
Absolutely. So I'll dovetail on that and then go back to my original answer, but absolutely behavioral health services. In BIPOC communities, behavioral health tends to be a social stigma. People don't want to talk about it because we are communal in nature, and there is a fear that it will result in being ostracized if we talk about, hey, something doesn't feel right up here, something's going on. And these are also the communities that are most underserved as it pertains to mental health, chemical dependency, co-occurring disorder treatment and services. So I am completely in sync with Toni about that, as well as basic health care. I will also say, and this is to my initial response, housing, because when people don't have the security of knowing that they will have a roof over their heads, it results in its own set of trauma. And you're not able to concentrate if you do have work, if you are in school, if you are in a training program, because there's always this lingering issue. When I leave this place, where do I go? Mm-hmm. And so it's more than creating shelter for folks who are currently unsheltered. It's more than doubling people up in places like where people are couch surfing. It's about having that security. We know what Maslow's hierarchy says. That's one of the basic needs that every person has, and that this country has been okay with people being homeless is really, it really speaks, it's an unspoken social commentary. So that's what I would say. And then the third thing is definitely education in all of its forms, that we must not lose sight that we must close the education achievement gap.
I just want to say really quickly to that, in this state, the behavioral health system for people of color is the criminal justice system. That is where we end up. And so when we talk about, we have to, words have power. We can't defund the police. We have to refund the police and refund the criminal justice system. That includes equitable resources, not just prisons and jails.
Amen. Amen. That we have to reconstruct the criminal injustice system. And I'm also giving snaps to the comments I'm seeing about free childcare.
Yeah, it seems to me that one of the things, you know, as I'm talking about sort of what's at the top of your policy list, that there's nothing, COVID has been devastating, but there is nothing new about what you both are pointing out, which is, and this tracks back to the beginning of our conversation, which is the gaps that were there that are the result of inequitably designed systems are compounded by the pandemic, but the answer remains the same, which is deconstructing those systems and purposefully designing them so that they get the results that we want, which are equitable and anti-racist. So I appreciate both of you sort of noting that what was once true before the pandemic remains true, compounded by the pandemic, but those gaps remain. I have a question from one of our colleagues. Neither of the panelists are from rural counties, of rural communities exactly, but what is the plan to ensure that rural communities are not left behind in this conversation? We have very few legislators left and we have no county commissioners. BIPOC populations are growing in rural Washington and we are not investing in rural organizing, getting support for the necessary investments in our communities.
Well, I would say I always remember the rural. There's nothing more rural than the Turtle Mountain Reservation in the middle of North Dakota, let me tell you. So I always think of our, and then my other grandparents lived in Montana, very rural. You're right. I think the one thing that I experienced, I have several staff members that drive in from the reservations around here that are rural. They can't work from home because of the lack of broadband or Wi-Fi. I know that the state has been putting money into that as a start. I just think it's being an ally, though. Whenever we have a conversation with the governor's support committee, you know, we say, who are the affected people? And hopefully I can be a good ally for rural communities. It's not an answer, just an observation.
Mm-hmm.
I want to say thank you for the question. And there are so many questions that are popping up in the chat. I just copied the chat so that I could respond to a lot of folks later. But I want to say this. I haven't talked about the organization that I lead, Metropolitan Development Council. We are a community action agency. We were founded along with many others in the 60s as a result of President Johnson's Declaration on Poverty. In the state of Washington, every county has a community action agency that is, and sometimes the organizations cover multiple counties. We are responsible for addressing the issues pertaining to poverty, persistent poverty, also social injustices. Hold us accountable. We are required to have at least a third of our board represent those we serve. So if you are in Pierce County, please reach out to me. I can also share with you what that service map looks like for the entire state. But this is what we are here to do. That's one example of those in the rural areas having a voice. Thanks.
Thank you. I'm going to move on to another question, inspired, Pam, by, Toni, by what you noted about land acknowledgements. Do you think that it could be effective to do truth and reconciliation at the state level? And what might it look like?
Well, again, I think as designed by Nelson Mandela and tried to be adopted in Canada, they're not doing as well as South Africa did. I think we have to do it every day. It's the action part of dismantling racism. It's acknowledging, it's saying sorry, it's making amends. Again, my drug treatment analogy, you make amends with the people you've hurt. You make a plan to move forward, and then you do it again if you need to, and you do it again if you need to. And every single system we have at every level needs to do it. Else we're going to stay here.
Mm-hmm. Pam, is there anything you'd like to add?
I'm sorry, in full transparency, I was writing down some folks who were reaching out to me and saying, please include me in your outreach. And so full transparency, I missed it.
That's all right.
I missed the question.
Doing the work of the question before. So why don't I move on actually to the next one? How do we sharpen our discipline in taking trauma-informed approaches to dismantling racism?
I think that's a question for the audience because I'm tired.
Mm-hmm. Fair.
We have to be, I think what I'm going to say, everyone already intuitively knows. We have to be committed to doing so. This can't be the flash in the pan, hot topic, soup du jour kind of thing. We are talking about our lives. We are talking about our legacies. For me, what I see as the representation of change about where we are is when subsequent generations learn about how we used to operate and say, you used to base your decisions on how people look, the color of their skin, the texture of their hair, how they identify, the culture that they come from. That's the dumbest stuff I've ever heard in my life. That for me is just an indicator of the change. But in order for that to happen, And that's just one indicator, because really, you know, what the data will tell us about disparities is really ultimately going to be the ultimate marker, but we have to commit to this work. And we can't be getting caught up in revisionist history that, oh, that really didn't happen, or, oh, that's not really good, to make people uncomfortable, because it will continue to perpetuate what we currently have. That's the best answer I can give right now.
Thank you. Let's do one more question before, maybe two, before we pivot. Here's from one of our colleagues. I appreciate the discussion and point about capitalism needing to be dismantled and how much women do this work. I think starting by taxing the rich and corporations in the state to fund needed services, education, childcare, et cetera. What is your take as panelists? And if you agree, how can we get there?
Now I'm reading the chat. I'm loving this. We're doing the dishes.
Paula, ask the question again.
I will ask the question again. Eyes on me. No. I appreciate, our colleague asks, I appreciate the discussion and point about capitalism needing to be dismantled, and basically says taxing the rich and corporations in the state is a means to fund needed services, education, childcare, et cetera. Do you agree? And how can we get there?
I don't know if capitalism needs to be dismantled. I don't think American can. I think it's in their DNA. I think it needs to be amended. And yes, however, that taxation can be amended. You have the power to do it. I don't even know the language, but let's do it. It hurts us to not do it.
Mm-hmm. Pam?
Everything Toni said, you know, we are a country that is founded on principles about the unalienable rights of people. Although we know that at the time that the preamble and the Constitution was written, that there was a certain dynamic happening, but this country was really built upon a defiance of to that which people had previously been subjected to. We need to take that principle, the defiance to that which we have been subjected to, which was found to be oppressive, and apply it to everyone. That doesn't answer the question about the taxation, but for me, it's about equity. It's about widespread equity for every person in this country, not just those who are already in a space of privilege. I don't know how much that answered the question.
So I'm going to move on to a last question, which I'm going to confess is from me. I am looking at, I'm just thinking about the major crises in this country, and whether you're talking about the Civil War or you're talking about the Depression, World War II, et cetera, that when this country has come up with big universal responses to its challenges, Black and brown people get left behind in those responses. And it's not left behind happenstance, it's left behind intentionally. So whether it is, you know, what happened after Reconstruction, whether it is being left out, the kind of work that our populations largely did, being left out of some of the aspects of Social Security, all kinds of things, whether it is being left out of the GI Bill, you know, college benefits being available, but college is not taking Black and brown people, or homeowner benefits, but folks won't sell to Black and brown people. So this is Paula's very long question, which is, as you look, and I know that both of you are history folk, at what we will be doing in response to this pandemic, how do we make sure we are not leaving people behind? Where do you see the possibilities of leaving folks behind, intentionally or unintentionally?
Well, I'll answer real quick. As the mother of 4 and the grandmother of 10, I'm pretty sure that the young people and people in this meeting, those who are standing in the streets every day, but they're standing in the streets with their phone and they're tweeting and talking and Instagramming, whatever. I'm pretty sure I have a lot of faith in a different generation to hold people accountable, to make sure we're included this time. We did not have those tools. I love it. I love listening to my grandchildren, who 4 or 5 of them are in college. I listen to them talk and I'm like, how empowered you have become at your young age, that we had to work through 30 years of pushing that BB up a mountain with our nose. And I really have hope. I mean, I really do. And it's wonderful.
Great. Thank you, Toni. Pam?
As I think about what it will look like to not leave people behind, I'm reminded, and those of you with whom I've engaged, you've heard me talk about Richard Rothstein's book, The Color of Law. I'm reminded of the ways that policies were put into place and became law that left people out. And we have to keep an eye on our policies. And we have to use that LASIK surgery when we look at those policies, when we look at laws, and they have to be repealed or amended, whatever it takes, so that people are not being left behind in terms of business owners, because we're seeing so many of these things happen right now, and access to basic needs. And the other thing that I will say is that because this is definitely a conversation about race as well. White people, allies, our compadres in this war to create a new way of living together, you have to be committed and you cannot go silent. We know silence is complicity. So please speak up, speak out, be your agent in your circles to help others understand what is happening in the world we live in.
So as we close up, I'm going to confess that I just did a very Seattle thing, which is I asked a question because I have an answer to it and I have a point that I want to make. So welcome to Paula's Town Hall. What I am particularly intrigued by is remembering that the rising tide does not raise all boats. It swamps dinghies. And we have been placed by history and systemic racism into dinghies, even though our communities have worked really hard to keep those dinghies afloat and strong. We are still placed by history in and systemic racism in those dinghies. So in the work that we all do as advocates, everyone on this call, really thinking about how we considered John Powell's targeted universalism approach, which is, of course, we are going to work on behalf of every Washingtonian, and we are going to recognize the people who are furthest away from opportunity. And we are going to recognize why, that systemic racism has designed systems that work perfectly to get the results that they do. So we're both going to change systems. We're going to flatten that racism curve. We're going to get that anti-racist LASIK. And we are going to adopt, and our encouragement, I think, is to policymakers and our fellow advocates to think about targeted universalism. Yes, recovery for everyone, and a recognition of the folks who are the furthest behind, and closing those gaps, making the bending that arc faster for the folks who have been most left behind prior to the pandemic and in the pandemic. So thank you, Toni. Thank you, Pam, for your brilliance, for your energy, for your spirit, and for everything you do. Thank you to the tech folks who helped us get over to Zoom. Thanks to all of you for your patience and talking amongst yourselves while we figured out why, technology was not smiling on us there for a moment. So now it is your turn, folks on this call. To ensure an equitable recovery, we each need to act, to use our power, to light that Angela Bassett match on systems that are designed to exclude and fail our fellow Washingtonians. So from this panel to you, here's what we're asking of you. First, we want you to go to your breakout, consider how the systems you discuss are working as designed to produce inequity and injustice, ask questions about racism and equity. Then when all these cameras turn off, consider your sphere of influence and responsibility and ask yourself three things. What do you know and what can you learn about inequities in your work or community? What do you know and what can you learn about systems getting perfectly inequitable results? And probably the most important question, how will you be accountable for deconstructing current systems and building new systems to serve all people? Thank you so much to everyone, to Pam, to Toni, to Abby, to the folks at the Budget and Policy Center, and to all of the folks who have gathered for Budget Matters for the work that you do and the work that we'll do going forward. And I'm going to hand it back over to Jennifer.
Thank you, Paula.
Thank you.
Thank you, Paula. Thank you, Toni and Pamela. That was such an inspiring conversation. I feel, and I hope others feel empowered and ready to burn it all down. I think walking away from this conversation, I really do hear the call to take action together and that we all have a role and responsibility in this work. And so I'm hoping we can all walk away more committed and thinking about all the ways we can be accountable.